Hello, my name is Zach. I'll be the nurse for tonight. Today we'll be going over trach sectioning and trach care. So as you enter the patient's room, you want to verify the doctor's orders of yes, he did order us to do trach sectioning, Mr. Laerdal, so that'll only take me about 15 to 20 minutes maximum. As we continue, you're going to provide privacy to the patient by closing a door or a curtain, and then you would answer or explain the rationale of why this is happening, answer any questions, and then get a verbal consent. So once we've gotten verbal consent, we're then able to raise the patient to hip level in their bed. We're going to place the patient in a semi-Fowler or Fowler's position, and then we would auscultate the lungs. Once we've auscultated the lungs, we would then increase the supplemental oxygen to Mr. Laerdal. He's going to be experiencing a little irritation due to us placing this tube through his trachea. We would perform hand hygiene. We would place our PPE on, which for this case will be a face mask, and then eyewear, eye protection of some sort like goggles, and then we would place all of our supplies out. So for the suctioning, mine's already out, I apologize. We'll be using this cup for saline, a sterile saline, and then also be preparing this, our catheter itself. Once all of our supplies are ready, you may don your sterile gloves. The hardest part of every skills check. Once our gloves are on, we would then be able to move forward. So we're going to start by coiling our catheter in our dominant hand. And with our non-dominant hand, we're going to start messing with the drainage and the suction. We're going to increase the drain to, or the suction power to 100 to 120 millimeters mercury. With the non-dominant hand, we would also take the tubing hooked up to that suction, move it and connect it to our catheter, turn on suction, make sure it's working, and move forward. We would then dip our end of our catheter in the saline solution to help lubricate it. Use our non-dominant hand to remove the trach mask itself, and with our dominant hand, we're going to just slowly insert this, not too rapidly, and you want to insert until resistance is met or a cough, and once you've met resistance, plug our suction and then begin pulling out. Suction does not want to last longer than 10 to 15 seconds. At that point, you'll just start drying out the mucosa. Okay, after that first pass, we're going to use our saline again and rinse. Get some cleaning done in this tube. And then we're going to repeat again. Left hand, move trach mask. The dominant hand, insert, and slowly progress the tube down. Keep inserting until you've hit resistance or a cough. And then you would plug and begin removal. Again, suctioning doesn't want to last longer than 10 to 15 seconds. Once that's done, you would disconnect your suctioning, throw away everything you don't need. Keep your gloves on, because we'll be moving towards, We'll be moving forward to the dressing change. So, at the dressing change, you want to notice the drainage itself around the tracheostomy. Notice, follow COCA protocols for the drainage. The color, the consistency, the odor, and the amount. So once you've removed this and looked at the drainage, we're then able to remove our first set of gloves, perform hand hygiene, and prepare our trach care kit. So, but this part is a little more step by step. You want to place a glove on your dominant hand first. Once our gloves are on, we then move to using our sterile saline and preparing some of our gauze. So this is a French straight gauze that'll be used for later. So like these cotton swabs or these gauze themselves, you would want to moisten just for the cleaning. So at this point we would then want to insert the new cannula that we were given by Central Supply, kind of like at a curve, and then you would want to turn and lock it in. It has a locking mechanism built into it. And we would then continue by using our moist Q-tip cotton applicator, and we just want to make sure that all the sides are clean, starting right around the ostomy of the trach, and then move out like so. So then we would stabilize our new trach with our non-dominant hand. Hold that there as we take our fenestrated and put that on. Once that is ready and stabilized, we would replace the trach ties. Can't really do that right now since I don't have a trach. But we would replace the ties through the eye of the trach, and then once that's almost secure, then we would remove the old and finish the new knot with a square knot. Alright, once that is finished, I'm sorry, my camera. Once that is finished, we would raise the bed. We would lower the bed to its lowest position, raise side rails up, lock the bed, place the call light, perform hand hygiene, and thank the patient.